I'm just getting some more people added before we get started. Awesome, welcome Yolanda. Awesome, welcome. Great, welcome. And for those of you just joining, I was just asking participants to go ahead and put your information, your names, pronouns, and where you are joining us from today into the chat, just so I get an idea of where people are coming from. Awesome, welcome. I love seeing people from the juvenile court joining. Awesome, welcome, Catherine. And Catherine, just so you know, tomorrow's session is going to be pretty specific for teachers. And I am providing clock hours as well. So I can give you that information for tomorrow's session. Okay. Yeah, do you want to just private message me, and I'll put that, private message me your email, and I will send you an email with that information so that you can get the clock hours for it. Oh, awesome. Seemar. Welcome, Carol. Great. Thanks, Catherine. Yeah, I will definitely plan on seeing you back here tomorrow. We're starting a little earlier. We're going to start 3:30 tomorrow. Oh, wait, today's 3. I'm getting, no, yeah, tomorrow's 3:30. Yeah, absolutely. It'll just be repetitive for you. It is the same content, yeah. For the most part, I'm doing a little bit more teacher specific stuff tomorrow and classroom and school specific. No, I'll send you the link and everything for tomorrow. I'm realizing that Catherine was direct messaging me the whole time. And so it probably sounded like I was just talking to myself and nobody knew what I was referencing. So we'll get started in about 2 minutes. I just want to wait to see if anybody else joins us. And if you are just joining us now, go ahead and put your information into the chat. I'd love to know your name, your pronouns, and where you are joining us from. Welcome. Awesome, welcome, Angela. Great, I'm glad to see. I know I had sent this information out to the juvenile court and out to the Pierce County court system. So I'm glad to see that this information was received and that so many of you got it, which is great. Awesome. Great. Well, thank you everybody for joining. I know I got a couple messages earlier in the week that there would probably be a couple people joining in late today. So I am going to keep an eye on the waiting room. But my name is Tovah Denaro, and I am an education and behavioral consultant in Washington State. I do a lot of work with school districts across Washington State. I support students in special education. I support students in the juvenile justice system in Washington State. I work with youth that are in the foster system. And really the big part of my work is supporting adults in understanding the social and emotional well-being and the social emotional learning of our youth. Oftentimes school systems and juvenile justice systems there's my partner trying to walk behind me. We have a couple dogs. We have a couple dogs and a couple teenagers in the house. So it's a little hectic right now. But a lot of the work that I do really is supporting adults with understanding how social emotional learning impacts our students' development, impacts our children's development. And oftentimes that idea, the SEL part of student growth and student understanding, can get lost in the systems that we have created, or they're not actually part of the systems that we have created yet. So today's session is really going to start us off on a 10-month session of these monthly sessions of really understanding how do we support our children's mental health through social emotional learning, right? And really to come to understand that we don't all have to be therapists. We don't all have to be counselors to understand that the mental health well-being of our children has to take priority. And we all have ways that we can support our children through their mental health and through those needs and some of those challenges. Please feel free at any time during today's session or any of the sessions that you attend to jump in and ask a question. You can raise your hand using the reaction button, or you can type it in the chat as well. And I will just warn you all before we start in on like an hour and a half together, I have a cold right now and I have a sore throat, so it's a little scratchy, so I apologize ahead of time. This is what today's session is going to look like. We are really going to dive into some of the data, the most recent data that has come out about understanding mental health through that youth lens. So where are youth at right now with their mental health? We're going to go through Rotenbrenner's ecological theory, and I'm really going to tie that into Maslow's hierarchy. We talk often in the school system about Maslow's hierarchy. But today we're going to really start to look at where does function of behavior play a role in that hierarchy. We're then going to talk about mental health and function of behavior and really look at trauma and how does trauma impact our children's behaviors. And that's what will lead us to the predictors of resilience, because we know that some children are more resilient than other children, even when they have maybe had similar situations. And we're going to look into that and talk about where can we as adults in some of these children's lives really play a role in building up that resiliency. And then I'll go over some next steps for our upcoming sessions. So we're going to be learning today that challenging behavior does have a function. And we're really going to learn strategies about how to identify what the function of behavior is. I will tell you, being able to identify the function of behavior is helpful in a school setting. It's helpful in the juvenile justice setting. It's helpful in any type of court setting, in any type of medical setting, so that we can start to come to understand why is a student or why is a child engaging in this behavior. And we're going to figure out how then do we pick an intervention from that. We know that some children might be impacted by their behavior, and throwing different interventions at them isn't going to help, right? That in that context, we're kind of just playing whack-a-mole, trying to figure it out. So today we're going to focus on what are interventions that we can actually walk away with some concrete steps to take and support the children and the youth that we work with. So as of right now, according to the Center for Disease Control, 1 in 5 youth in public school show some signs of a mental health disorder. So go ahead and in the chat box, what are some examples that you can think of that would be signs of a mental health disorder? What are some things you can think of that you might see from that children might be exhibiting? Aggression, yep, aggressive when approached, absolutely. Tardiness, moodiness, absolutely. Not participating in social activities with others, yes. Shyness, yes. Yeah, grades falling behind. Bullying or being bullied, right? Absolutely. Yes, dysregulation of mood. For sure. Everything that you all put in here could be a sign of a mental health disorder. And it could also be a sign of adolescent, right? Of a young child, of a middle school age child, of a high school age child, right? We know that children and the way that their brain develops and the way that they are developing go through ebbs and flows of emotional regulation and emotional dysregulation. When we start to determine whether or not we need to start looking more deeper in terms of a mental health disorder, it's when this is impacting their day-to-day life, right? Self-harm, another really important one to consider. And I will also tell you, because some of you put this in the chat already, we know, and many of you have already put, sometimes it's those quiet behaviors, right? Sometimes it's the behaviors we don't necessarily see, the shyness, right? The students not coming to school, the students not participating in social activities, that we then let those students fall through the cracks, right? Because when we think of inappropriate behavior, when we think of behavior we don't want to see, in our society, we're thinking of aggression, right? We're thinking of acts of violence. And it's really that behavior that sometimes we don't see, the self-harm, the shyness, the withdrawing from activities, that we have to really lean into to start focusing on to see what's going on with that child. And the most recent data from 2016 says that by the time youth have reached the 7th grade, right, so about 12 years old, 40% of students will have experienced some type of mental health problem. This could be maybe anxiety, depression. 40% of students. And what we also know is that more than 1 in 3 high school students have experienced persistent feelings of sadness or hopelessness back in 2019, which was a 40% increase from the previous decade, right? 40% increase. In 2019, approximately 1 in 6 youth reported making a suicide plan within that past year. And again, that was a 44% increase since 2019, or excuse me, since 2009 from that previous decade. So that right there shows us that there is a discrepancy between what we are doing in classrooms, what we are doing to support students in schools and community-based organizations, and how students are feeling, right? The impact that we are making. And here's a visual. This is from the CDC that was put out last year. Again, within that 10-year span, among youth aged 10 to 14, suicide rates increased 56%. And between 2007 to 2017, suicide rates among youth ages 15 to 19 actually tripled. Right, so we're seeing that there is work to be done here. Now, what I did not do with this data is I didn't disaggregate it. So this is all students that took these surveys back in 2007 through 2017. And as we know, individuals who are historically marginalized, so this is Black and Brown students, it's students within the LGBTQ community, it's students in the foster care system. We know that we see higher rates of suicide among those youth, among those individuals. We also know that this past year for everybody has been pretty intense, right? I don't know any working parent that did not have some type of breakdown last year, right? This past year, COVID has been really challenging for families of all different kinds across the country and really across the world when it comes to how are we balancing school, how are we balancing home life, how are we balancing work life, and then how are we supporting and keeping our family together. And so really quickly, I'm just going to go over Rotenbrenner. He was an ecological theorist back in the day. And what he determined is that, as you can see from this visual, we, the individual, are in the center of this system, these systems. And everything outside of this system of ourselves, it impacts us. We have a relationship with these systems. We have a connection to these systems, right? So that first system is our microsystem. Who are we most connected to? Who do we have the most relationship with? Prior to COVID, it typically looked like family, right? Maybe the school system, maybe a church group or a neighborhood play area. Maybe we had easy access to health services, right? And then we have the mesosystem. And sometimes these, for example, our health services, our peers, they kind of go in and out of the mesosystem to the microsystem, right? Sometimes we're closer with people, sometimes we're less close to people. There's an ebb and flow between the micro and the mesosystem. And then outside of the mesosystem, we have our ecosystem. These are the people that are also part of our community, but a little further away, right? Our neighbor, who maybe we know we can go to for an emergency, but it's not somebody that we spend all of our time with. We know that we would have access if we needed it to social welfare services, to legal services, our friends of family. And then finally, what is holding all of these systems together is the macro system. And that's the attitudes and ideologies of the culture that we live in. So even within the United States, based on how you were raised, based on socially how you were brought up, you might have different attitudes and ideologies of who's in your exosystem and can they be trusted? Who's in your meso and microsystem and can they be trusted? Because of COVID, we know that these systems have been looking different lately, right? We know that especially when we first got put into some form of lockdown, that microsystem became much smaller than what we were used to. And even for some individuals, that exosystem kind of became non-existent. And the individual, so us as an individual, we became much more reliant not only on ourselves, but on technology, on the computer that we carry around every single day, which is our cell phone. And Patricia, I see your hand raised. Did you want to unmute yourself?
I was also starting to do a chat. I wanted to know where social media fits in.
Oh, well, perfect. I'm so glad that it's like I planted you as a little bug, Patricia. So yeah, what we know of right now is social media is in that little red circle for a lot of our youth, right? Social media. I have 2 teenage boys that live with me. I would say it's very close to an addiction, what many of our youth are experiencing with their connection to social media and the influence, because all of these systems influence us, influence the individual. And so when you start to think about social media, that is one of the biggest influences of our youth right now. And so right in front of you is the triangle that is very famously known as Maslow's hierarchy. And as we know, when we talk about Maslow's hierarchy, we talk about that we need to have that foundation. The physiological needs have to be met before we even consider the safety needs, before we consider belonging, esteem, and then finally that self-actualization. So when we think about physiological needs and we think about some of the youth that we support, the youth that we work with, I know that in classrooms, sometimes I'll go and I'll be introduced to a very dysregulated child, let's say a first grader, and come to find out the last meal that this kid had was lunch the day before, because the kid doesn't have dinner at home and was late to school that day, and so didn't get breakfast either, right? So the basic need of just eating food had not yet been met, right? So we oftentimes, as adults, as individuals who typically are good at self-regulating, we sometimes don't necessarily think about the ecological influence of the youth that we work with and the youth that we support, in addition to their hierarchy of needs, right? Because we know that some youth, right? Some, in terms of, let's talk about the macro system, there are attitudes and ideologies about law enforcement that some of our youth have. There are attitudes and ideologies about doctors and teachers that some of our youth have. And some of these ideologies are literally ingrained in them. It's generational because of generational trauma that their family has experienced. So they've carried on some of these attitudes and ideologies. When we talk about function of behavior, we know that at the core of all behavior, we are trying to seek to gain or avoid something, right? And often the origin of maladaptive behavior is really from trying to seek to gain a Maslow deficit within a toxic environment, right? So for example, if the physiological need that is not being met is food, an individual might need to go and find a way to get food for the family. And maybe it's not in the safest way possible, right? What are those things that we can't live without? A sense of belonging to someone or to a particular group. We know that there is a social need for youth, especially when they start to form identities based on community, which is usually around 10 years old, 11 years old. So they might start to be involved in behavior that is not appropriate, but it's in order for them to feel like they have that sense of belonging. So we know that there is a lot that is impacting our youth right now, right? We know politics, personal factors, censorship, maybe censorship in the classroom, education hot topics, right? California just said that every school-age child will be required to get a COVID vaccine. That's a pretty hot topic right now for individuals that live in California. We also know that inconsistent messaging can hugely impact youth, especially youth that are already impacted by trauma. There are social issues happening, there are inequities going on all the time. And so we need to recognize that when a youth engages in a maladaptive behavior, in an inappropriate behavior, they are inherently protecting themselves, right? We always want to recognize that a child doesn't engage in behavior because they are just out to get us. The child is engaging in a behavior because they don't have the skills to use their voice to communicate their needs, and they have learned that this behavior is getting their need met. Which shows us that all behavior is communication. Our youth have learned that it works for them to engage in this behavior, right? So just like this visual shows you, when we are talking about challenging behavior, it's either to escape, right? And that's a person or an activity or a setting, or it's to gain that attention. Typically, it's either adults or peers, right? It's either to gain an activity or an object, or something we often don't talk about is to escape or gain some type of sensory input. Right, we see this and we know that sensory input is important for individuals with a variety of different neurological conditions, right? Individuals on the autism spectrum, for example, might need to escape from too much stimulation or might need to gain some sensory stimulation. But what research is telling us and what we are seeing is when youth have had the on in their childhood, and we're talking about 6 months of age to 9 months of age, that sensory input is something that they might be having a struggle with, they might be challenged by. And so trauma can also impact sensory input. So what behaviors have you seen? what does this look like for you in your experience, either if you have children at home or just in your work, in your day-to-day life? What have you seen youth do to gain attention? Let's just start with that. And again, either in the chat or you can go ahead and unmute yourself. What have you seen youth do to try to gain attention? What are some of those examples of attention-seeking behaviors? Yeah, pick an argument, definitely. That defiance. What else? Yep, deliberately breaking rules. That happens for sure. Provocative comments, yes, definitely. Trying to get a rise out of you, see your response or your reaction. Yes, I was supporting in a preschool classroom last week. So I was there to observe a student with some pretty challenging behaviors. And it was amazing the comments that were coming out of a 4-year-old's mouth. I was like, that is a new one. I have not heard that yet. What about to avoid attention? What have you seen kids do, or what has your experience been when trying to avoid attention? Yes, isolate. Put your head down. Don't show up at all. Yeah, sleep. Absolutely. I remember when I first started out in 2010, I started out as a high school teacher, and I worked exclusively with students that were diagnosed with an emotional and behavioral disability. And I was so green, right? Like I was right out of school and ready, to work with these high school kids. And I had a student who from the first day of school, he started cutting class. Like he wouldn't show up to his classes. And I was like, oh, that's so interesting. I wonder how he learned today, like he could just cut his classes. And then I became a middle school teacher a couple of years later. And I had a middle school student, a 6th grade student, the same thing, first day start cutting classes. I was like, oh, okay, they must learn this in middle school, right? Like this is where they learn how to cut classes. Well, believe it or not, right? I go into preschool classes now, and there are already students that are literally cutting their class, right? They do this and they engage in this behavior because it has worked for them for so long. Yeah, they excel in school to not be noticed, right? Yeah, they wear their hood indoors. They wrap themselves up with clothes. Absolutely. All of these are examples. And then what we'll sometimes see for individuals who are trying to gain a sensory, that's when you'll start to see some of that self-stimming activities, right? So you'll see students maybe if they are, they'll be shaking their hands, they'll be doing quick movements, they might be pacing to gain some of that sensory. I've seen some students who have actually, they'll push other kids, where originally we thought that the function of the behavior was to gain attention, but it was actually sensory. Like they liked the pressure of pushing a student. And then of course, to avoid sensory, that's when students might turn lights off, leave the classroom. It's overwhelming. They might yell to try to avoid and get out of that sensory stimulation, that sensory area. We know that students have a handful of ways, we've just named a couple, to gain or to avoid whatever the need is that is not being met for them. And we know that mental health can compound behavior, right? So whenever we see a problem behavior, and when I say problem behavior, I'm really talking about that maladaptive behavior, the main behavior of concern. There's always a trigger, right? So there's something that happens like right before the behavior, and this is what provokes it, right? So maybe you tell the kid, hey, take your hood off, and then the kid escalates and there's a problem behavior. And what's important, and this is how mental health can compound this behavior, is the antecedent, right? The setting event. This is what increases the likelihood that the trigger is going to provoke the behavior. And so oftentimes in educational settings, we focus more on the trigger, what happened right before the problem behavior, when we actually need to be focusing on the antecedent, the bigger picture, right? The bigger picture is where mental health can compound behavior, because if a student is also impacted by some mental health challenges that have not been addressed, the likelihood that a trigger is going to escalate the student is much higher. And of course, to finalize, it's that maintaining of consequences, the function or the purpose of the problem behavior. So when I talk and use the word consequence, I'm not only speaking about, you know, a negative or a positive consequence. I'm talking about why did the student engage in the behavior that they did. Now, I want to bring up the function of power and control, because I've heard this oftentimes, and actually I've heard it a lot within the juvenile justice system, that the child doesn't want to, it's not about avoiding or gaining, the child just wants control over the situation. And so we want to be really cautious about using that language, because the function of power and control is really not supported in any research literature around function of behavior. And what we know, what seems like it might be power and control, is typically usually access, right? Access to peer attention or access to adult attention. And so we want to be, this is why it's so important to recognize the trigger of what happened when the behavior occurred, so we can start to determine, is it attention seeking, attention avoiding? Is it, you know, task seeking or task avoiding? And just like somebody had written in the chat, right? We think about bullies, like, why do they do what they do? And again, what we all know is that what research shows us is that many youth who are bullies have been bullied themselves, or have some underlying trauma that is impacting their connection and communication with other youth and other children. So mental health really is that overall wellness of how you think, how you regulate your feelings, and how you behave or how you respond to others and yourself. When we start to experience a significant disturbance in our mental functioning, this is what can lead to challenging behaviors in the school setting, in the court setting, in the juvenile justice setting, in the medical setting. A mental health disorder may be present when patterns or changes in thinking, feeling, or behaving cause distress and disrupt a youth's ability to function. So we can't rule out that some type of mental health disorder might be present when we are seeing challenging behavior. And I want us to move into understanding trauma a little bit in terms of our behavior. And so just to reiterate, and we don't have to read all of this, but we know that when we work with youth who have a history of trauma, that alone will increase their risk of negative outcomes throughout their life, right? The ACEs study shows us this. When children have been exposed to a traumatic event like COVID-19, their individual interpretation and reaction is largely determined by their interactions among their history of trauma exposure. So how they have been exposed to trauma previously. The adults that they live with, are they able to self-regulate? Or does the child see a lot of dysregulation? Do they talk through their issues or concerns, or do they sweep it under the rug? Right? What are those ways academically, socially, emotionally, and behaviorally that these children are able to express their fears, their concerns, their nervousness and anxieties in a way that is healthy and constructive, rather than destructive. And so we're going to talk about trauma a little bit and how trauma shows up with our behaviors. I'm going to take a quick sip of water. So what you see in front of you is a picture of a brain, right? A simplified version of a brain. This is like the Tovah brain version. On the bottom of the brain is where you see that pink and red area, right? This brain stem. This is the reptilian brain. This is the first part of our brain to be developed in utero. And this is why sometimes you might hear it called like the dinosaur brain, the instinctual brain. This is the area of our brain that supports fight, flight, or freeze when we feel like there's a threat. We then have the limbic brain, and that's that little that part of the brain in right in the middle. You can kind of see it's like there's a yellow piece, a green piece, an orange piece. This limbic brain is responsible for our emotions. It's responsible for our feelings. And the limbic brain doesn't fully get developed until adolescence, right? It actually starts to really trigger and really fire during puberty. So if you work with any 12 or 13-year-old kiddos, you know what I'm talking about. When they start to see the world through an emotional lens and not quite through the rational lens. The last part of our brain to get fully developed is the neocortex. And most importantly is the prefrontal cortex, which is right in the front of our brain. This is our rational thinking brain. Those prefrontal lobes do not get fully developed until our mid to late 20s, typically between 25 to 27 years of age. But we expect 16-year-olds, 17-year-olds, 18-year-olds, 20-year-olds to be making rational decisions about their life and their choices. All the time we do that. And that's okay. In fact, that's great because that is what starts to trigger their prefrontal lobes to be firing to start making those rational decisions. So when we think about questions of morals, when we think about doing the right thing, when we think about impulse control, all of that is controlled by our prefrontal lobes, by this rational thinking brain. What is really important for us to know as adults that work with youth is that youth who are impacted by trauma live in their reptilian brain. They are chronically in fight, flight, or freeze because they have learned that they have to survive. They're not worrying about anything else but surviving. When you are in your reptilian brain, worrying about surviving, your prefrontal lobes are not being triggered. Nothing is firing, which means that there is a delay in development of the prefrontal lobes. So our youth who are impacted by trauma, who then show up with significant behaviors and sometimes maladaptive behaviors, may need more support from us to get them back into their prefrontal lobe, back into that thinking brain. Any questions about this? All right. So in front of you is an image of a nucleus. And really quickly, I just wanted to show one other brain visual of how trauma shows up for us. Trauma holds a physical space in our brain. So as you can see off of this nucleus, all of those little squiggly lines are dendrites. And dendrites are our communication pathways, and our behavior pathways and our patterns of behavior, our patterns of communication. For example, have any of you ever been at a job for a while and you've had a long, exhausting day, you get in your car, you start to drive home, and before you know it, you're home and you're like, how the heck did I even get here? Like you literally have no memory of getting there. That is because, and I'm sure all of you are like nodding to yourself right now, that is because there is a physical memory in our brain of how to get home without actually even thinking about it. And when our dendrites start to myelinate, so down on the left-hand side, you can see that the dendrites are thicker. That is when we have even more, yeah, I see Jordan says many times, the thicker our dendrites are, the more quickly that pattern of behavior comes to us, the more quickly that thought comes to us. When we have a thin dendrite that's just being developed, it's a new pattern of thought or pattern of behavior, we might not always think that. It might be new to us. But when the thicker they get, the more it's ingrained in us. This happens with trauma. So as an example, if a young child has been primarily abused at home by a maternal figure, that child might identify all women as being abusers, if that is that child's experience, because that dendrite has been so myelinated to believe that women are bad because that has been the child's experience, right? This has to do with cultural competency too. The more that we have been told to believe maybe a bias or some type of microaggression, the more it becomes ingrained in our brain. And when youth have experienced enough trauma, it starts to develop around their mental models. They become socialized to believe that that trauma is the truth. And that shows up for them in their feelings at first, right? So their thoughts turn into feelings. I feel scared. My thought is that's a bad person. I feel scared. And then the feelings are what lead to behavior. And the behavior could be, I'm going to leave the space now because I don't know how to talk through my fear. Or I'm going to hit somebody because I don't know how to self-regulate. Yep. So Jordan, thank you for bringing that up. The best part about our brain is that it is malleable, right? We can change our brain. We are constantly relearning and reteaching ourselves and others. And so although this is something that becomes ingrained through positive relationship building, through cognitive behavioral therapy, through talk therapy, through building trusting relationships, we can start to build a new myelinated dendrite with the new belief system, which is pretty fascinating and amazing. And this is why I think it's so important to talk about trauma when we talk about children and behavior. Because what happens is when a child starts to behave in a way that pushes us away from them, and I work with a lot of foster kids and I see this all the time, they're doing it to prove themselves right. They're doing it to say, I knew that Tovah was going to leave me. I wanted her to leave me. I wanted it to be on my terms. I wanted Tovah to leave me, right? So they can prove themselves right and they can myelinate that dendrite even thicker so that they can tell themselves, I told myself it's true, women are dangerous or women can't be trusted. The more that we stick with and support a child who is going through these mental models, the more that those dendrites will become thicker with a new belief system and a new belief pattern. And so just like, and just what Jordan had mentioned, we can unpack these negative belief patterns. And there are 4 that are really important to think about with how they impact our children's behavior. Trust. That can show up as the child doesn't trust any adults or the child doesn't trust themselves. Power and control. That can show up as I have to have control of everything. I have to have all the power. Or somebody else has to have all the power for me. I can't make up any decisions on my own. Esteem. I don't have any self-esteem. I don't have any self-respect. On the other end of that, I'm not going to show you any respect. And then intimacy. I can't soothe myself. I don't know how to be alone in my thoughts. And on the other end of that, is I can't trust anybody. I can't be alone with anybody. I only can be alone with myself. I can only be with myself. And so these negative belief patterns can become extremely cyclical for youth when they don't have therapy, like cognitive behavioral therapy, other forms of talk therapy, to work through some of these belief patterns and stop the belief pattern in the moment. Which brings me to, how do we build this resilience? What are the predictors of resilience? Because we know that we work with youth who are impacted by significant trauma. And for whatever reason, they have had the resilience to move through it and to work through it and be successful and be productive. And we know that other students and other youth don't have that same experience. So these are the main predictors of resilience: intelligence and cognitive ability, positive caregiving or positive parenting, self-efficacy and positive self-perception, any hope or faith or religious affiliations, positive relationships, self-regulation skills, and self-efficacy. And these three are taught in the school system, right? In schools, the expectation is we are teaching self-efficacy, we are teaching self-regulation, we are teaching self-perceptions, and we are building positive relationships. That is the expectation when we are an adult supporting youth. And this comes from CASEL, and CASEL is the Collaborative of Academic and Social Emotional Learning. They're kind of like the gurus, the main creators of social and emotional learning nationally. And Washington State follows their guidelines. And so what CASEL outlines as the 5 most important social emotional learning competencies are self-awareness, self-management, social awareness, relationship skills, and responsible decision-making. And we know that in order for students to regulate more quickly, in order for youth to be able to manage emotions and limit their impulse, they need to understand social emotional learning. They need to know, what does it actually look like to manage my stress? What does it look like to talk through an issue, to problem solve effectively? So CASEL outlines the variety of ways of what this looks like within a system, and identifies, right, for self-awareness, how are we identifying emotions? For social awareness, what does empathy look like? How do we teach empathy? For relationship skills, how do we teach communication, right? What does this actually look like? And we know that for all students, social emotional learning has to be based on their need, right? So when I talk, and I talk a lot in tiers, I don't know, it must be an educator thing. But when I talk about tier 1, I'm talking about every youth that you work with has access to this. What is that? That's going to look different for every setting, right? At CMAR, what does every single youth that comes through CMAR's doors have access to, right? Then we know that at the tier 2 level, there's going to be about 20% of students that tier 1 interventions did not work for. The universal interventions were not working for them. And so we need to build in some smaller, more specific interventions for that group of students, group therapy, right? And then we know that there's still going to be students and youth who need even more access to more individualized social skill instruction. And that's going to be about 1 to 5% of the youth that you support. And so in a school setting, this is typically what it looks like, right? We have the social emotional learning, and then how does this align to mental health, right? At the tier 1 level, we typically should see some type of a curriculum, and we should have a mental health screener, right? At the tier 2 level, There should be some targeted social skill instruction and some group counseling, right? Some type of coordinated referral. And then at the tier 3 level, right, that's individual. We're talking about crisis counseling there. So what does this look like for you in your line of work? What does social emotional learning look like for the youth that you support? And go ahead, again, you can unmute yourself or type it in the chat. How have you engaged in social emotional learning with children? I know for yeah, thank you, Angela. Establishing routines in the home, classroom circles of conversation. Yes, role playing, absolutely. Establishing routines at home, at work, in a classroom, that is trauma informed because so many of our kids come from chaotic situations, chaotic environments. And so having a routine that they know the moment they enter your space, the moment they enter home, whatever that looks like for how you are working with youth, it's going to be routine, right? They know what to expect. Yes, definitely. Being present in the moment, listening, and I always say this, listening to hear rather than listening to respond. Oftentimes as adults, we try to respond to problem solve for them, but sometimes we just need to sit and be there with them. Yeah, being around positive adults with secure and safe environments. Yeah, though I don't know if any of you know Dr. Bruce Perry. He's a doctor and a researcher on youth trauma in the brain. He just put out an amazing book for those of you interested. He wrote it with Oprah Winfrey, and it's just fascinating. But he says that there is no better neurobiological intervention than one safe adult. And so just like the question Jordan asked earlier, like if it's so ingrained in our brain, how can we help kids? It's because you can be that neurobiological intervention. You can be that one safe adult. And the more safe adults that are in a child's life, the more resiliency that child builds up. So starting to consider interventions and what this looks like. First, we have to remember when we resist something, when we resist a feeling, it's going to persist in us. So we need to have open and honest discussions with our youth. Avoiding the conversation just leads to more anxiety. So be honest with the kids, right? Show your vulnerability. That is okay. Talk about what they are excited for. Talk about what they are nervous for. Talk about what will change and what won't change, right? And just like Patricia mentioned, children in foster care need stability and reassurance, right? So many of the foster kids that I support ask me, you know, hard questions like, am I going to have to go back to that person? Questions I can't answer. And so this is when we can say, I hear how scared you are, right? And I am going to be with you every single step of the way, right? Don't give them any empty promises, but be honest with them. We also do something that we call name it to tame it, right? We want our children to be able to identify their concerns. So we ask them, what are they worried about? And then we can name it, right? And so for little kids, this might be, you know, we name fear the worry monster. An older youth, might not want to name it the worry monster. And so you would label that emotion as anxiety or as fear or frustration. Often when we name the worry, it helps to tame the fear inside because we start to build an understanding about what the feeling is. It also gives us some language that can be used in the future to give us some more opportunity of those emotional supports and coping strategies, right? If I know right now I am feeling anxious and I build tools around this feeling of anxiousness, in 2 weeks, when I have the same feeling, I'm going to have those tools. So we want our kids to be able to name what they are feeling. Another example is giving children options of how they can calm down, how they can cope, and practicing them before the moment. Because oftentimes when our kids are in the moment of fear, of anxiety, again, they're not in their prefrontal cortex, they're in their reptilian brain. And so we need to teach into this work when they're in their prefrontal cortex so that they can access it when they're having a hard time. And then focusing on positives. It's so helpful to start and end the day on a high note, right? So just even focusing on the things your child might be looking forward to, right? Maybe seeing friends, maybe seeing a teacher, having a daily routine. So many kids are actually excited for that. And before school starts, just asking, like, what are you looking forward to? What was the best thing that happened today afterwards? And if you only see youth monthly or a couple times a month, that's fine. Start the conversation with a positive. And we never want this to feel ingenuine. We never want this to feel inauthentic. And so for some of our kids, the positive might be, hey, you showed up today, and I am so grateful that you showed up today, right? That might be the positive, and that's wonderful. And of course, promoting some problem solving, right? Identifying some solutions, discussing some different options. Somebody mentioned role playing. Encourage the child to try out the solution to figure out whether it's going to work for them or not. Visuals are a really helpful reminder for youth, right? All the way up to 18. I was supporting in a high school today and getting a kid set up with some visuals because of the anxiety that he was feeling because today's schedule was wonky at his high school, right? So giving him a very set schedule so he knows what to expect, right? Having a timer, a schedule of when, be excited, it's pizza night, or be excited, I'm coming and, visiting your home in 2 days, right? Having some visual reminders can be really helpful to put their mind at ease so that when they are in their reptilian brain, when they are having some challenging thoughts, they don't have to access reading to be able to know what you're trying to tell them or know what is expected of them. So here's some some examples. YouTube has awesome, if you work with kids who are cognitively impaired, if you work with youth who are on the autism spectrum, YouTube has amazing visuals of social stories for like wearing a mask or social distancing, things that we did not have to think about 2 years ago, but we have to think about now. For older students, right, for older kids, having a to-do list that they can check off can be really satisfying for kids. And, right, relationship is the #1 precursor to all of this. A to-do list might not work for everybody, right? You know these youth best. Having some type of reinforcement chart, this will help them find their motivation. What are they motivated by? What are they interested in? Giving them an interest inventory, right? So that when they are feeling frustrated, when they are feeling upset or angry, where are other areas that you can lean into to remind them, hey, after school today, this is what you have to look forward to, right? During our meeting tomorrow, this is something you have to look forward to. And of course, being a role model, right? And this is at home as well as at work, right? Setting a limit for screen times. I have to do this with my own family. Not always the easiest thing, but really important for the adults too. Having opportunity for the guardians, for the family, however they define family, to come together and just have a conversation. Right, positive affirmations go a really long way. And like we talked about earlier, leading with that active listening. I said this before, but having that consistency and predictability. The more consistent and predictable an environment it is, the less anxiety for that youth. All right, we have time for questions, for as many questions as you all want. It's a nice small group. And what I'll do is maybe have you all use a hand raise, some reaction, and then I will go ahead and unmute you. Remember, I was a teacher, so I have great wait time. Any questions about today's session?
Yes, this is Natasha. Is this recorded?
Yes, it is.
Okay, so we can rewatch if we would like, or
yep. Yes, you will have access to this. Yeah, just like Len says, this is a heck of a lot to consider. Absolutely. The work you all do with youth right now is so much. Our youth are experiencing a different type of trauma than has ever been experienced before, at least in this lifetime with our children. And so being able to recognize all of the pieces to the puzzle, there's a lot there, right? There's a lot that is compounding the social emotional need and support of our children right now. Yeah, of course. Thank you all so much. I'm going to, so coming up in November, it's going to be the same time. I'm actually going to be leading you all through social emotional learning for us, social emotional learning for adults. So it's really tips and tricks for self and others, talking about compassion fatigue. We know that when we work with youth who are impacted by a lot of trauma, who are impacted by challenging behaviors, we sometimes experience either secondary trauma or compassion fatigue. And so I'm going to be talking about what does that look like for us, and what can we do to mitigate that and to hopefully avoid getting compassion fatigue. And thank you all so much. That is my website as well as my email. So please feel free, if you have any questions that come up, go ahead and email me. I am always available. And if it would be helpful, I'm also happy to share these slides with you as well. Thank you. Yeah, thank you all so much. And I hope to see you in November. And I won't have a cold then, I promise. Yeah, let me hear. I'm going to stop my screen share. I guess I shouldn't promise not to have a cold, but I really hope I don't have a cold. All right, I'm going to download this quickly as a PDF, and then I will share these slides with you all. All right. Let me open that. Yes, this is a lot to process, absolutely. All right, I went ahead and the slides are slowly uploading, so you'll have access to them. So again, if anything comes up after you go through the slide deck again that you want to reach out and ask me for, please don't hesitate. That's what I'm here for. All right, thank you, everyone.